The APHIAplus project Nuru Bonde aims to ensure sustainability of the programs it is implementing, especially in the communication component. As a communication unit of the project, we aim to ensure sustainability of the activities we are doing. And to do this, we are working with the districts to ensure that they have capacity to be able to carry on the work that the project is doing beyond the project lifespan. And to this end, what we are currently doing is establishing BCC committees in each of the districts we work in and building their capacity to be able to continue on with these activities beyond the project. So far, we have established about 20 such committees. And one of the outcomes we are already seeing is that these committees have really created a synergy. The stakeholders involved in the communication in the district have hitherto been doing their own vertical interventions without collaboration or synergy and duplicating efforts and so on. So the committee is intended to synergize all this, to coordinate and to prioritize communication activities in the district settings. Okay. Already, from what has happened to date, in the last 1 year, we are seeing that these committees are really viable. They have work plans. They are coordinating activities. The partners are sharing resources. They are sharing their experiences. And the work in the district is getting better coordinated. And going forward, we think these committees, being subcommittees of the District Health Stakeholders Forum, will get resources set aside to ensure that the work goes on. And beyond that, even the partners who are non-government organizations, because the committees have the non-government organization, the ministries, and the faith-based organization. So the resources can be levied from all these partners to ensure that they have resources to work with to sustain the work beyond the project.
The purpose of calling this meeting was to have the stakeholders in board because we wanted to come together and talk together on issues pertaining to health communications in the district. We felt it is important to have them in board so that we can share the experiences, we can get to know what each partner is doing, and know where we can link one partner probably and another, and also the ministry. This is because we have realized that we have not been performing well in terms of health communication interventions.
It's an important meeting. We will continue to hold it. I have an information officer here who has been given that responsibility to coordinate. She is the promotion officer, so you need to know her. So you must be able to strategize based on our local community. The literate enough. What is their practices? Good way, good language they understand. Let us put those things together and ensure that we bring one individual who is healthy. Mtoto mmoja anakuwa na afya mzuri, akiwa mchanga, akiwa an adolescent, when he becomes an adult, when he becomes 8, you know, you can have a health old man, of 8 years but healthy. We should have people who are healthy of all ages, and that is our responsibility in the whole system. That is why we must have a strong communication in our systems. So let us support each other. You are welcome.
Kwa majina bado najulikana kama Judy Akini, nafanya kazi na shirika la APHIAplus. Olivia Gabriel Kimani, nimetoka kikundi inaitwa Kimana People Fighting AIDS Together in Loitoktok.
Majina ni Joan Bonde. Nimetoka Bomba la Tumaini. Preferred Friends Fighting AIDS Together.
Mary Aserian, Boma la Tumaini.
I'm Milkan Jerry from Treaty Department.
Hey, my name is Jonathan Musip. I work for Bonde, Kenya.
Kwa majina naitwa Victoria. I'm working for Bonde, Kenya.
Kwa majina ni Shabani Ramadhani. Niko Kajiado. Nafanya health promotion.
My name is Robert Lisiru Nyambuki. I'm a volunteer.
I'm Alma Agade. Nimetuma kuwakilisha kikundi cha Deliverance Youth Group. My name is Unity Club from the Education Office.
Yeah, my name is Jojo Bani. I'm a communications officer with APHIAplus Nuru Bonde.
My name is Dr. Stephen Mutiso. I'm Deputy Medical Superintendent.
Mimi naitwa Zuma from Probation Department.
We have appreciated that it is a very important team, and you also mentioned about the messages that we have put across. They must be targeting a particular group and also the channel that we are using. Health communication activities and the achievements which has been done by APHIAplus so far, and the objectives will include improve the quality of health and social programs implemented by local implementing partners aimed at achieving improved health outcomes for adults and the youth. We are not limiting ourselves to the youth, we are also looking at the adults. To increase the reach of comprehensive individual and group level youth interventions conducted by partners that are evidence-based and or meet the national guidelines. Of course, there are the guidelines for the health communications that we should always be within them. To build the capacity of community structures, especially those supported by the government of Kenya and their respective ministries or departments, to increase focus and deliver comprehensive interventions. That's where we have all the departments around from the government. We have behavioral interventions, and some of the messages has to be prepared towards this. The first one is training and regular contact with the peer educators, provision of accurate and current HIV, STI, reproductive health information, provision of condoms and water-based lubricants. When we come to presenting HIV messages, and also for those who are infected or affected in one or the other, I think stigma is an issue, especially in Kimana, the media. Yeah, I'm sure it's now going down after a whole world where it presented something.
Men having sex with men. If they come for services, they must get services.
So I think we might need also people who have experience in identifying the men sex men, so that we can also bring them on board.
Doctor, you can find a way of seeing how you can talk to some, because they have a network. You only need to talk to one and you get into their network and really get them out.
When we are introducing the topic in the region, we face a lot of challenges, a lot of the idea that it's not part of us.
Yes.
Now you see, Mutiso is telling us here that this thing is here with us. Now we need to start talking about it more and more, because if it is existing, then we need to give a lot of emphasis to it.
What I can show is this: what happened in Kajiado with the Dance for Alice. It was a day that she had organized, whereby we had a forum with all the officers in charge. Then we sensitized them on the MAP program, who they are and how they should be treated. So those days are now familiar with it, and then now it's not like at first it was a shock thing, and we are told that we need to respect them the way they are, regardless of what they've chosen to be.
It has not been accepted because it is not practiced here, especially in our country.
You're still living in denial.
What I'm saying, these things happen in urban areas. If you come to areas like this one, it's very hard to find such a thing happening.
So they recruit some in the town and then they introduce them. During the peak season, it's very busy. So you will not be able to tell very easily, but people will be disappearing in the evening, coming back in the morning.
And it has come out clearly that it is being practiced where we are.
How do we identify?
Not in Nairobi now this time. Possibly, whatever Judy is saying, that those are some of the things we need to be sensitized on how to identify some of these people.
But now, even with the drop-in center, we had at least a program that was running, and the program was a success. For the sex workers, it is very hard without those strategies in place to have them. The head teacher also raised the challenge that some of the boys are also dropping out of school due to, the moral kind of thing and that. That one is true, I agree. But the girl child is more affected.
Very much concerned with the girl child. And like we were in another seminar, and it was established that we concentrate so much on the girl child and forget about the boy child.
Yeah, but now the program has only been designed to reach out to the girl child. But through the SDH, the social determinants of health, they offer scholarship to both children, boys and girls, as long as they are vulnerable.
And if you see, if you go to the villages, most of the boys are not in the schools; they are just riding cows. So I also proposed that we change that one instead of concentrating on the we change that one. Yeah.
Change, yeah? Okay, we agree with you, and I agree also with him. But the design of the project is that it's going to reach out to a girl, and they looked that a girl is more vulnerable.
But what we can blame here is culture, which is also making the girl child vulnerable. Also making the boy child vulnerable. While at the same time, tunataka kuinua msichana, tunaacha kijana nyuma sana.
That's when we realized that 100 kids are enrolled in a school whereby you have a number of like 40 girls and 60 boys. But 1 year down the line, you'll get the boys are increasing in the same class and the number of girls are.
Then we have scholarship. This scholarship will be given to this child who is willing to go back to school, but still she's coming from a poor family. So through the SDH in APHIAplus, the social determinants of health, we have like some scholarship that are given to these vulnerable children to enable them to be in school. As we're going to be rolling out this program, we have those teachers who are the mentors who have been trained. We will have to do the same sensitization to the entire teachers in that respectful school. So they'll have to know what the program entails. So we even identified some girls who are there because of their culture, they are not able to go back to school. So what we did was to sit down with the parents, the girls, their mothers, and talk to them and introduce the topic to them. And now, what we're going to do is like to send somebody who is in charge of the program to go and interview the kids and foresee who qualifies to go to school at what time. So we find that most of the girls do not complete the whole class 8 level. So they reach like in class 4, like the ones that we got in Rombo. Mtu amefika class 4 anasema mimi niko tayari kuolewa. So I'm asking like, surely, unaweza kwa mama ya mtu anakwambia baba yangu alisema haoni maana ya kufundisha msichana. Sasa mimi ni lazima niolewe. You see? So the culture also hinders. We need to join hands together for us to have a smooth running of the program.
Communication objective. That increase positive attitude about their personal ability to refuse sexual advances. That's all.
The district held its second forum, which has been held every quarter, has been addressing issues of health within the district. But we have not had a specific forum where all the stakeholders in the district meet, especially the ones which are dealing with issues of health promotion.
APHIAplus project went to deliver these services directly to the counties, and the counties were not getting involved, were not having the capacity to do them. So this particular strategy works very well with the devolved systems, which is the county-based management system. So at the moment we are working with these committees and the counties to develop communication strategies that are contextualized to these counties to ensure that whatever is being done suits the county environment and context, rather than the previous situation where these things were being implemented from outside the county. We have been implementing this for the last 1 year, and some of the major lessons we have learned is that these committees have been able to settle down, and they are already having plans that is guiding the work they do. These committees are coordinating efforts so that the players, the communication stakeholders in the districts are no longer working in their own silos, but working as a team and as a committee to implement things that are kind of integrated.
Hallelujah.